According to Public Health's weekly data report, it states that starting January 29th, Guam started seeing its initial decline in case rates, but this was also just days after Public Health announced only symptomatic and high-risk residents would be tested. The new data also indicates our test positivity rate remains high at 40%. However, Public Health Territorial Epidemiologist Dr. Ann Pabuski says this doesn't mean we're in the clear.
We're not there yet. We're still in our surge, and we hope to see. I hope it's the light at the end of the tunnel, but we're not out of it yet.
And it's clear we're not there just yet. According to Public Health's data, the surge at hospitals continue with increases in daily hospital census. Additionally, there's an increase in ICUs, while deaths appear sporadically. As for the arrival of the spin-off of the Omicron variant and more transmissible BA.2, lead epidemiologist Dr. Annette David says residents must continue to hold the line, particularly our island's elderly and those with comorbid conditions.
While it's less severe, it's not something to be taken for granted because it's still, with people who are weaker and have less of an immune response, it can still be quite devastating.
As for on-the-ground combat against COVID-19, the Operation Homebound team has already visited 32 vulnerable families identified in the recent point-in-time count. According to Public Health COVID-19 Incident Commander Fernando Esteves, they're now going off the grid, targeting other areas identified by the Guam Homeless Coalition.
As an example, they've been to Tengisan, some areas in other areas in Hagatna, and they continue to do so.
Meanwhile, Public Health will be reopening the MAB Treatment Center in Mangilao on Thursday. Additionally, we've received an additional 30,000 test kits, with 70,000 more expected by the end of the week or early next week. Daniel Perez reporting for Guam's News Network.